Position the patient in a modified beach chair position using an Allen table to access the entire shoulder. The C-arm is positioned from behind or across the patient to allow for AP and cephalic tilt views. Make a 2 to 3 centimeter incision directly over the fracture site. Care should be taken to avoid the supraclavicular nerves. Medial prep objective. Prepare canal to at least 50 millimeters past the most medial edge of the fracture. Elevate the medial fragment and sound the canal using 2 millimeter and 3.5 millimeter drills to a minimum depth of 20 millimeters. Use caution to prevent penetrating the anterior cortex with the drills. Advance the spade tip guide wire until the 50 millimeter long gold section is completely past the most medial edge of the fracture. Note that the most medial edge of the fracture may be on the posterior surface of the medial segment. Use the 4.5 millimeter reamer on power to ream the canal to the tip of the wire. For certain fracture patterns, it may be preferred to use hand awls to prepare the medial fragment to the required 50 millimeter depth. Lateral prep objective. Create optimal lateral exit point by exiting posteriorly along the center line of the bone and lateral to the conoid tubercle. Elevate the lateral fragment and use the 2 millimeter drill to define trajectory to exit point. Use fluoroscopy to ensure the trajectory to the exit point is vertically in line with the coracoid process in the AP view, lateral to the conoid tubercle. Advance the 3.5 millimeter drill to cortex. Insert the 4.5 millimeter Amer awl to complete the trajectory lateral to the conoid tubercle at the equator of the clavicle. Drive the 1.6 millimeter K-wire through the Amer awl, tenting the skin posteriorly. Drill over the K-wire with the 4.5 millimeter cannulated drill from lateral to medial to the fracture site. Remove the K-wire from the drill. Reduce the fracture. Insert the spade tip guide wire through the drill and into the medial fragment. Remove the drill bit and advance the 4.5 millimeter reamer over the guide wire. Ream to the tip of the guide wire. Detach the power and advance the reamer depth gauge over the reamer to measure the necessary implant length as indicated by the mark on the reamer shaft. Remove the reamer while retaining the guide wire. Advance the implant insertion guide over the guide wire and into the lateral fragment. Remove the guide wire and inner guide handle, retaining the guide channel. Advance the CRx implant along the guide channel and into the lateral fragment. Withdraw the guide channel before advancing the implant to its final position. Expand the implant active lock grippers by turning the actuation driver clockwise until the white lines become collinear. Then remove the actuation driver. Insert the soft tissue trocar and external sheath through the outrigger until it is firmly against the posterior bone. Lock the position of the external sheath using the thumb screw. Insert the 2 millimeter drill guide and drill through the implant. Select the screw length indicated by the drill guide. Subtract 2 millimeters for countersinking. Then insert the screw using the 2.5 millimeter hex driver. Detach and remove the outrigger and close the incisions.